Hey everyone, it's Josh at Prescription Fitness, Physical Therapy, and Sports Care, doing another video for October, which is National Physical Therapy Month. I thought we'd just talk quickly today about diagnostic imaging and do we need it. One of the biggest pet peeves that I have personally in the clinic, and this is more directed towards spine patients, is when they come in and they say things like, well, how do you know what you're going to do? We don't have any imaging, or I haven't had an MRI yet. I need to have an MRI for us to be able to treat it. And I think the problem is that diagnostics shouldn't be used to necessarily diagnose. So they're there to confirm our clinical assumption based on clinical examination and confirm that, but it shouldn't go the other way around. It shouldn't be the first thing we do is some sort of diagnostic imaging, and then for, let's say, a spine patient, say, well, you're a 7-year-old and you have degenerative disc disease, so there's your problem. Well, there's a radiologist locally who hands a piece of paper to patients which says for each decade of life, here are normal findings in asymptomatic individuals, and by the time we're 60-95% of asymptomatic individuals will have degenerative disc disease, arthritis, spinal stenosis, spondylosis. So it's just finding stuff that we all have. So if you live past 50, you're probably going to have some of these things. So don't make the assumption that that's what I have, because I think if we do that, then some patients think, well, if I have arthritis, yeah, how do you fix arthritis? You can't fix it, and that's true. We can't fix it, but there are still things that we can do to help that patient. So I think we have to be careful in making assumptions about anything, and let the physical therapist come up with a clinical model. We had a patient also who was a general surgeon, a great general surgeon here locally in the area, treated in a time where we didn't have lots of diagnostic tools available. And so I asked him, I said, how did you become so good at what you did? Because patient selection for surgery is super important. If you do the wrong surgery on the wrong patient, well, they're not gonna do well. So, when I asked, he said, I had to do a good clinical examination. I thought that was great, because that's exactly what we think as physical therapists. So, good clinical examination is the key to successful outcomes. So, we should demand that from all medical practitioners, and physical therapists. I just think we do a much better job. That's in our training. This is how we should do it. Not that all of us do that, from what I see sometimes, but yeah, that's how we should do it. The other thing is just be present. Take the time, be present in the moment. Put your phones down every once in a while and just relax. At the end of our treatment sessions, we turn out the lights and let you kind of reflect on how things went, or just take the time to take a nap, because as an adult, when was the last time you were able to take a nap in the middle of the day? So take that time, just be present and enjoy it. So if anyone has some suggestions of other videos you'd like to see, please send it to our Facebook. Otherwise, it's Josh at Prescription Fitness, Physical Therapy, and Sports Care in Geneva, New York.